Ophthalmic instillation of medications is a form of topical administration used to facilitate examining the eyes or to treat various disorders of the eyes. During an eye examination, the provider might instill drops to anesthetize the eye, dilute the pupils for easier examination, or stain the cornea to identify any injuries or abnormalities. Besides those given to enhance the examination process, medications are given by the ophthalmic route in the form of liquid eye drops, eye ointments, and medication discs inserted much like a contact lens would be. Inserting a medication disc is called intraocular administration. Common eye medications administered in a variety of preparations include antibiotics to treat infections, glucocorticoids to reduce inflammation, lubricants to reduce irritation from dryness, beta blockers and prostaglandin analogs to treat glaucoma, a wide variety of drugs to treat allergic conjunctivitis, including ocular decongestants, antihistamines, mast cell stabilizers, and NSAIDs, and as mentioned earlier, anesthetics, anticholinergics to dilate the pupil and paralyze the ciliary muscle, and dyes such as fluorescein to facilitate examination. Lubricants, as well as some of the vasoconstrictors used to treat allergic symptoms, are available over the counter for self-care. Also, contact lens wearers self-administer various preparations to enhance comfort while wearing their lenses. When you are preparing to administer eye drops to a client, follow the same initial steps as you would for any medication administration. Screen the client for allergies to the medication, explain the procedure along with what to expect during administration, the desired effects, and the possible adverse effects of the drug. Make sure you are administering the prescribed amount and strength of the drug to the right client by the right route at the right time. Be careful to determine whether the medication is to be instilled in one or both eyes. Cross-check the medication container with the medication order and check the drug's expiration date and be absolutely certain that the medication you are about to administer is an ophthalmic preparation. Prior to administering an eye medication, assess the client's eyes and surrounding structures. Evaluate the appearance of the eye and the structures for any lesions, exudate, or swelling. Note any inflammation, discoloration, or discharge from the lacrimal gland. Ask the client if he is experiencing any itching, burning, blurred vision, pain in or around the eyes, or sensitivity to light, and notice if he is squinting, blinking excessively, frowning, or rubbing the eyes. Ask yourself if the client has any signs or symptoms that would warrant withholding the medication and notifying the provider. Finally, determine if the client is able to cooperate during the procedure. A confused client or a small child could move suddenly and cause injury or contamination. Make sure help is available, as this procedure can easily frighten small children and confused clients. So be especially gentle and reassuring as you administer the medication. When you administer eye medications to a client, you must take special care to prevent eye infection and injury. Wash your hands thoroughly before and after the procedure and wear gloves during the procedure. Remember that infectious material is easily transmitted from one eye to the other. If you are putting eye medication into both eyes, be sure to wash your hands before and after you medicate each eye. You must also be careful that the dropper or ointment tube does not touch the eyelids or other eye structures. Doing so can contaminate the medication remaining in the container. Plus, it can cause discomfort or injure the sensitive cornea. You'll also position the client with careful attention to preventing infection. Help him assume a comfortable position, either sitting or lying, with his head tilted slightly backward and slightly toward the side you will medicate. This helps prevent the accidental flow of excess fluid and secretions into the other eye. Another useful tip is to rest your hand on the client's forehead as you instill the drops. It stabilizes your hand and ensures that your hand will move with the client if he moves suddenly. This simple precaution reduces the risk of striking the client's eye with the dropper and injuring it. And remember, never instill an eye medication directly onto the cornea because it is so easily injured. Now let's go ahead and demonstrate the installation of an ocular decongestant prescribed to relieve allergic conjunctivitis in the left eye. We'll assume the nurse has verified the client's identity, screened the client for allergies, and explained the procedure and its effects. She has also checked the medication record for the appropriate drug, dosage, strength, route, and time, and has checked the container's expiration date. She has also verified that the medication is an ophthalmic preparation. She then assembles her equipment. She will need the medication container, clean gloves, sterile absorbent sponges or cotton balls soaked in sterile saline irrigation solution, and a dry, sterile absorbent sponge. The nurse washes her hands and puts on clean gloves. She helps the client into a comfortable position, either sitting or lying, with his head tilted slightly back and to the left. Using the moistened cotton balls, she cleanses his left eyelid of any crusts or drainage, starting at the inner canthus and wiping toward the outer canthus to prevent the transfer of infectious organisms to the other eye. She then instructs the client to look up toward the ceiling and gives him a dry, absorbent sponge. She exposes the lower conjunctival sac by drawing down the skin over the client's cheekbone. She approaches the eye from the left side and instills the prescribed number of drops onto the outer third of the lower conjunctival sac, making sure to hold the dropper tip about a half an inch, that's a little more than a centimeter, above the sac, making sure it touches none of the eye structures. Then she asks the client to close his eyes gently and press firmly on the nasolacrimal duct with the dry sponge to keep the medication from flowing down the duct and into the nasal and pharyngeal passages. This is especially important for medications that can cause systemic effects. If this had been an eye ointment, the nurse would have held the applicator above the lower lid margin and applied a thin stream of ointment along the conjunctival sac, from the inner canthus to the outer canthus. She then would have instructed the client to close his eyes and gently massage the lid in a circular motion with the sponge, if not contraindicated, to help distribute the medication. Following an ophthalmic installation, discard your gloves, wash your hands, and document the procedure. Also, evaluate and record how the client tolerated the procedure, as well as the client's response to the medication, including therapeutic as well as adverse effects. When teaching clients to administer eye medications to themselves or others, remind them to wash their hands thoroughly before and after the procedure. Then instruct them to use a separate towel or tissue for each eye if only one eye is infected. Avoid sharing face towels or tissues with other household members. Store eye medications away from direct heat and freezing temperatures. Cap medications tightly. Discard old, cloudy, or discolored ophthalmic solutions. Discard unused eye medications once the treatment regimen is completed and report any problems to the provider.